When Pittsburgh made headlines for being one of the worst places for Black women to give birth, maternal and child health professionals came together to rewrite that narrative. Recently, the Allegheny County Health Department created a space to share stories about what the department and organizations such as Healthy Start are doing to improve birth outcomes.
It's really important that you continually update that information. It's really important that you continually know where Black women are positioned in the city of Pittsburgh. And I think this is a real opportunity for that to happen. It's an opportunity for us to not only give the numbers statistically what's happening with women in Pittsburgh from an economic, social, housing, all those perspectives, but it's important to also know where Black women are just on an everyday basis. And when I looked out into the crowd at today's conference, what I seen was not only legislators and community leaders, but I also seen Black moms there who could speak specifically to what is going on in their lives. And I think that is the value of having these in-person interactions.
I think events like today's really bring people together, again, to work, hopefully to find some new voices, to engage more people in the work. And so the more people that come to the table, the more effective that work is. And so this is a way to promote that work, to share out what's already happening, but then to find new ideas and really to start more conversations so we learn more from actual events. And I think storytelling is a really important part of the birthing and parenting process. And so hopefully people today will share stories that will be impactful for the future.
I think it's just all has to do with understanding and accountability on both ends. You know, they're so quick to bash Black or brown, brown moms when we do something wrong. It's the headlines, but it's very rare that when companies or organizations do something wrong, the first thing it is that they do is either blame it on the moms or cover it up with some other type of statistic or numbers, or this is what happened, or if this person wasn't exposed to this, then this wouldn't have been that outcome. Like, no, as we are adults and we're grown, like, oh, this is what I did, I messed up, I'm gonna take accountability for it. It shows a lot about people's characters. I think it would help people be more trustworthy of each other if we were more honest.
The truth is hard to face. In Allegheny County, Black babies are 5 times more likely to die before turning 1 than white babies. Black women experience almost twice the number of preterm births and more than twice the proportion of low birth weight babies when compared to white women. And just as horrible to hear, Black women die from pregnancy and childbirth-related complications at a rate higher than 97% of similar cities. Those startling statistics won't change overnight. However, the outcomes can significantly improve through an equity-centered, community-driven approach.
So when we say equity-centered, we're really talking about centering those who are most impacted. And so in Allegheny County, we know that Black women and babies have the worst outcomes, health outcomes and quality of life. And when we talk about community-centered, we really know that we need to look beyond clinical medical care and make sure that community members and those with lived experiences are engaged in our work.
Healthy Start, in collaboration with the Allegheny County Maternal and Child Health Strategy Team and other partners, produced the Allegheny County Birth Plan for Black babies and families. The living document builds on work currently being done to eliminate inequities and focuses on 4 areas: strengthening the maternal and child health workforce, which includes doulas, lactation support, mental health professionals, physicians, and others; strengthening systems of care, including healthcare, public health, social services, and family support services systems; addressing the social determinants that impact infant and maternal health, such as living wage, paid leave, employment opportunities, and affordable and accessible childcare, transportation, and healthy food; and coordinating maternal child health initiatives and increasing equitable funding.
We have to capitalize on all of the momentum happening at the state and federal level. The Paid Family Leave Act, right? We need to focus on that. Postpartum Medicaid extension, reimbursement of doulas, right? Really elevating the work of birth workers. All of those things matter in ensuring that both all women's experiences, but particularly Black women's experiences are heard.
Until then, the Coalition will work together to combat the racial inequities and center the lived experiences of those most impacted. To review the birth plan, make suggestions, or offer your skills or expertise on the matter, visit healthystartpittsburgh.org/infant health equity.